What does scleral show in lower eyelid surgery? Imagine looking in the mirror after a cosmetic procedure and noticing more of your eye's white area showing than before. That's what we call scleral show, a condition where the white part of your, known as the sclera, becomes more visible beneath the colored iris. In the context of lower eyelid surgery, or blepharoplasty, scleral show often refers to an unintended outcome where the lower eyelid pulls downward or retracts, exposing more sclera than normal. This can make your eyes look wider or more startled, but it can also cause some discomfort or eye problems. Normally, the lower eyelid sits just at the edge of the iris or slightly below it, covering the sclera. When scleral show occurs, the eyelid is positioned lower than it should be, revealing more of the sclera below the iris. Doctors measure this by looking at the distance between the lower eyelid margin and the edge of the iris or the corneal limbus. If this distance is larger than normal, it indicates eyelid retraction or scleral show. This condition can happen after eyelid surgery if too much skin, muscle, or fat is removed, or if scarring pulls the eyelid downward. Several factors can cause scleral show after lower eyelid surgery. Excessive removal of tissue during the procedure can weaken the eyelid support, leading to laxity or drooping. Scar tissue from healing might also pull the eyelid downward. Sometimes, the eyelid's muscles or structures are damaged or weakened during surgery, especially if the surgeon is not careful. Age-related changes in skin and tissue elasticity can make the eyelid more prone to retraction after surgery too. The significance of scleral show goes beyond appearance. It can cause functional issues like dry eyes, irritation, or even damage to the cornea if the eyelid does not cover the eye properly. When the eyelid is retracted or pulled downward, it can leave the eye exposed to environmental irritants, leading to discomfort and sometimes more serious problems if left untreated. To prevent scleral show, surgeons carefully plan the procedure, aiming to remove only the necessary tissue and preserve the eyelid's support structures. During surgery, they pay close attention to the position of the eyelid and the integrity of the muscles and connective tissues. If scleral show develops after surgery, treatments include procedures to tighten or reposition the eyelid, such as canthoplasty or canthoxy, which reinforce the outer corner of the eyelid. Sometimes, scar tissue is released, and soft tissue grafts are used to restore proper eyelid position. In some cases, additional procedures on the midface or cheek can help support the lower eyelid from below. For mild cases or symptoms like dryness, non-surgical options such as artificial tears or lubricating ointments may provide relief, but they do not fix the eyelid's position. Understanding scleral show is important for anyone considering lower eyelid surgery. It highlights the need for a skilled surgeon who can balance aesthetic goals with the preservation of eyelid function. Every person's anatomy is different, and risk factors vary. Proper surgical planning and technique are essential to minimize the chance of scleral show and to address it promptly if it occurs. Always consult with a qualified healthcare professional to discuss your individual needs and risks before any eyelid procedure. In summary, scleral show in lower eyelid surgery is when the eyelid pulls downward, exposing more of the sclera, which can happen due to surgical factors or healing issues. It's a condition that requires careful management to restore both the appearance and proper function of the eyelid.